So, how do you apply your nursing problems when writing the nursing care plan? So, we'll take this example for starters. Let's say Mr. John was involved in a road traffic accident and they sustained injuries. Manage this patient using the nursing care plan. So, the first thing that you do is you identify your problem. So, because Mr. John was in a road traffic accident, there's a possibility that he might be suffering from a problem which is known as pain. Not so. So we'll put pain under the heading problems. Then you move on to the second heading, which is the nursing diagnosis. So remember, in the nursing diagnosis in our previous video, I had spoken to say that this is the one that highlights the nursing assessment, meaning you looked at the condition of your patient. Then you also identified the cause of the problem as well as the signs and symptoms that were present. So in your nursing diagnosis, you will say that pain related to injury from a road traffic accident evidenced by patient verbalizing, meaning your patient is communicating that they are in pain. Or you can say evidenced by patient expressing signs of pain, meaning you're able to see facially that my patient is in pain. Then from there you move on to the third heading, which is the objective or the goal. So in the objective or goal, last time in our last video, I had spoken to say this one indicates your plan on how you're going to manage the problem of the patient. Then it also shows the time frame that you are going to work under in order for your patient to get better from that problem they are suffering from. So in your goal, you will say patient will be relieved of pain within 30 minutes of nursing intervention. So our goal is to ensure that our patient is relieved of pain within 30 minutes of nursing intervention. Then when you go to your nursing interventions and rationale, which is heading number 4, here you are going to say, I will administer prescribed painkillers in order to relieve pain. So remember, in the nursing intervention and rationale, I had spoken to say here you write what you're going to do for your patient. Then you also give a reason for doing that particular action. So in this case, we're saying I will administer prescribed painkillers. So that is the action, administering the painkillers. Then the reason for doing that is because I want the pain to be relieved from this our patient. Then finally, the evaluation. Evaluation, we had spoken to say this is now the assessment that is done in order to look at the results of your actions on the patient. Is the patient much better?